Good evening, everyone. My name is Sophia Brown, and I am a member of the NYU Myers Alumni Association Board. On behalf of my fellow board members, I welcome you to the social justice conversation with Nursing Association leaders. Tonight, our panelists will be sharing how they are advancing health equity in the profession through education, practice, scholarship, and community partnership. I would like to introduce you to Dean Eileen Sullivan-Marks, who will introduce the program. She has been the Dean at NYU Myers since 2012 and is the past president of the American Academy of Nursing. She is a distinguished nursing leader, an educator, and a clinician known for research and innovative approaches in primary care. She also has experience with testing methods for payments for nursing, sustaining models of care using advanced practice nursing, and developing healthcare policies in community-based setting. Dr. Sullivan-Marks.
Thank you, Dr. Brown, and welcome everyone. I'm so thrilled on behalf of NYU Rory Myers College of Nursing to have this important conversation this evening and such distinguished panelists on social justice and health equity. Here at NYU Rory Myers College of Nursing, we have a strategic plan that we call Thinking Big or Being Big, and BIG stands for belonging, innovation, and global. And belonging, of course, means that in order to feel like you belong, you have to feel that there is equity, justice, and that we as a profession are addressing both within our profession issues of equity and equity in healthcare. One of the things that we have done both in our strategic plan and in moving forward is making sure that we are attending to equity in every aspect. And that is why I'm so proud of our alumni board to take this conversation to you, our alumni and friends. We have established last year a partnership with Howard University School of Nursing and Allied Health Affairs. Dean Gina Brown and myself here at NYU have started not only a memorandum of understanding, but exchanges in faculty and student activities so that we can learn from one another, Howard being an historic Black college and university that brings new sense of how we as nurses should come together and create careers and pipelines. One of the things as past president of the American Academy of Nursing that I've been able and privileged to do is be a member of the commission run by ANA on addressing racism in nursing. And several of our panelists are involved and commissioners on that commission as well. The American Academy of Nursing in the last 2 years has also been a professional organization, realizing that we have to address both within our profession and across our patient care, advocacy, and delivery, how health equity must come together. So I don't want to take too much time away from this very exciting panel and your questions that will be answered and discussed toward the end of the day. So now I turn it back to you, Dr. Brown, for a discussion of our panelists, and thank you all again for attending.
Thank you so much, Dean Sullivan-Marks, for opening the program for us this evening. What a framework to lean by. Health equity through the lens of being big, belonging. I would like to move forward to introduce our panelists for the evening. First, I will introduce Dr. Mary Joy Garcia-Dia. Dr. Mary Joy is the president of the Filipino Nursing Association of America, and she works as the program director for nursing informatics in the Information Technology Department and the Center for Professional Nursing Practice at the New York Presbyterian Hospital. Mary Joy served on the Equity, Diversity, and Inclusion Committee for the Future of Nursing. It's a campaign for action, and she's also a member of the American Nursing Association National Commission on Addressing Racism in Nursing. Next, I will introduce Dr. Julius Johnson. Dr. Johnson is the president of the Greater New York City Black Nursing Association chapter. He is currently the Family Nurse Practitioner Program Director and Assistant Professor of Nursing at the Long Island University, Brooklyn. He specializes in home-based primary and high-intensity translational care intervention and has worked on several projects with safety net hospitals to reduce hospital readmission, reduction program fines. He is also the co-founder of drnurse.com. You got to check that out. Next, I would like to introduce Dr. Adriana Nava. Dr. Adriana is the president of the National Association of Hispanic Nurses. She serves as the Chief of Quality and System Improvement within the Veteran Health Administration and has been in service to our nation veterans for most of her nursing career. Dr. Nava, thank you for your service. She focuses her effort on building the leadership capacity of nurses with a focus on Latino nurses who continues to be underrepresented in healthcare leadership positions. Next, I would like to introduce our moderator, Dr. Emerson Ia. He is the Associate Dean and the Clinical Associate Professor at NYU Myers School of Nursing. His scholarship interest is in the area of nursing education and innovation, immigrant health and well-being, and cardiovascular health. His publication focusing on focusing on topics that relates to work and personal outcome among internationally educated nurses, Filipino immigrant health, gerontology nursing, and nursing education and practice. Dr. Ia will be our moderator tonight. Just before we go into the panel, I have a few instructions of how you can participate as we listen to our panelists this evening. So at the end of the discussion, there will be a Q&A session. At that time, we'll be able to address as many of your questions as possible. So while the discussion is going on, go ahead and in the Q&A box, enter your questions, and we will address as many as we can at the end. Now, I'm going to turn over the event to Dr. Ia and our panelists.
Thank you so much, Dr. Brown. As what Dr. Sullivan Marks stated earlier, this is a very important conversation, and we are very honored to have the leaders here of different nursing organizations. So we also look forward to your questions and engagement. So please post your questions. But I'd like to start this conversation by asking the members of our panel if you can tell us a little bit about your organization, maybe a brief history, and more specifically, how is your organization advancing social justice? So I'm going to turn this over to Dr. Dia, followed by Dr. Johnson, and then Dr. Nava.
Thank you so much, Dr. Emerson Ia. First of all, I would like to thank NYU Rory Mayers College of Nursing and its Alumni Association for having us all together with these leaders in our organization. And it's funny that how you asked the question, what is the history of our Philippine Nurses Association of America? Because we celebrated our 45th 40th anniversary in 2019, prior to the pandemic. And I was so looking forward to be inducted in 2020 when the pandemic happened. So we are now going into our 43 years as an organization all across the United States. And what's great about the organization is that we are comprised of 55 chapters all across 43 states. But the origin of the history of PNAA is because of the coming together of 5 chapters, particularly New York, New Jersey, Michigan, Illinois, and Southern California, in addressing the issues of discrimination during the year between 1960s and 1970s. It was really spurred by the case that was presented against 2 Filipino nurses who were accused of killing 11 patients in Ann Arbor, Michigan. And allegedly, it was them that was supposed to be sort of like a scapegoat at that time. But eventually, these nurses were absolved of that case, and it was dismissed. So out of that story, the different chapters, these 5 chapters, came together and unified to form this group now called the PNAA. So we are really rooted in advancing social justice within our community on behalf of the Filipino American nurses.
Good evening, everybody. And I just want to thank NYU Alumni Association and Dean Marks and everybody else for having me. So I'm the president of the Greater New York City chapter of the Black Nursing Association. We are a chapter that is under our umbrella national chapter, which is the National Black Nursing Association. We just celebrated 50 years as an organization this past year. We're looking forward to getting back in person next year, finally, post-pandemic. The history of the National Black Nursing Association was that we had a group of Black nurses that wanted to come together and give a space where Black nurses can collaborate together, exist together, and really just be a part of a professional organization while giving back to their community. Our chapter in New York City was founded in 2017, while we also do have another chapter in New York that is as old as the organization itself. Our New York City chapter, Greater New York City, was founded in 2017, and we really came together because we wanted to give a voice to nurses all throughout New York City. And we also wanted to transcend some of the ideas of what people thought as traditional nurses. We wanted to be involved in every level of care, education, practice, policy, research, but we also wanted to be deeply involved in our community. And we wanted it to be that whatever Black community throughout New York City had a problem or issue related to health, they were able to find one of us and we can speak up for them and be a voice of reason for them, as well as actually provide services for them. We currently have grown into becoming the second largest chapter within the organization. Some of the things that we're doing to advance social justice goes from doing healthcare screenings, partnering with organizations. After George Floyd's murder, we held a rally just surrounding racism in America and why it's a public health crisis, and advocating for different things, advocating for police reform, creating points, talking points, as well as creating an agenda for police reform or what that looked like. We held during COVID, when it was disproportionately affecting minorities throughout New York City. We brought together politicians from across the state at the local, state, and the national level with nursing leaders throughout New York City to talk about the disparities that we was facing. We collaborated with NAN on advocating for testing centers within our neighborhoods, because at first the majority of testing centers were in Manhattan, whereas the urban areas was being hit very hard. Well, the outer boroughs was being hit very hard, and we felt like we needed more testing centers. We also ran vaccination sites with your very own at NYU, Dr. Selena Gillis, my partner, where we ran multiple vaccination sites and we also participated in over 100 pop-ups and vaccinated over 30,000 people, with 80% of those people being minorities, which was a huge thing considering the COVID vaccine hesitation. And we really just continue to be on the forefront of anything that we can related to health within our communities.
Hello, I'm so excited to be here today and be with my fellow leaders and also with all the NYU alumni. Thanks for having us. My name is Dr. Adriana Nava, and I'm the president of the National Association of Hispanic Nurses. And NAN was founded in 1975, so we're in our 46th year, by Dr. Ildura Murillo Roth. And if some of you have noticed in the Google Doodle that celebrated Hispanic Heritage Month, there was a nice write-up and doodle image of her telling about her story and how she founded NAN. She was also an NYU alumni, so that's really exciting to share with the group here. But the need for having our organization come to light happened during an ANA conference, and they noticed that some of the needs of Hispanic nurses weren't being addressed. So this is when a small group of Latino nurses came together to form what is now NAN. So the mission of NAN is to advance the health of the Latino community across the US, and we also want to lead and promote and advocate for the advancement of Hispanic nurses. And our organization ties well into advocating for social justice because all of us are volunteer leaders, and we are deeply embedded within our communities and are able to address their needs. So our members focus on creating educational programs and focusing on delivering preventive care services to our communities who sometimes don't have access to this. And even during the pandemic, this was highlighted throughout the country, especially for our Latino community who was severely impacted, although we've known that disparities have existed for underserved communities for a very long time. So one of our main goals as an organization is to become a national leader in Latino health. We want to see nurses at the forefront, advocating for changes in policy, and also advancing clinical practice for nurses. So this may seem like an audacious goal and will take time to achieve, but we believe that as nurses, we have the empower to improve the health of our communities.
Thank you so much, panelists, for providing our audience a brief history of why your organization, each of your organization came to be. I'm taking notes here, but there is great history in your organization, and the reasons why you formed really hit on belonging, really creating or representing voice of your constituents, really advocating for your members and for the causes that you stand for and that you represent. But there's also a hint of that collaboration is key to really advancing your goals for the organization. So my question to the panel is really more focused on collaboration this time. How do you see collaboration in advancing your social justice goals or realizing your goals to really impact health of the population that you serve? So I'm gonna start with Dr. Mary Joy Garcia-Dia again, followed by Dr. Johnson and Dr. Nava.
So our chapter, different chapters of our organization have worked collaboratively within the community. In fact, PNA New York, where I belong to, have worked with NYU Center for the Study of Asian American Health through the collaboration with Kalusugan Coalition, which is a grassroots organization. And we have facilitated grants through the CDC, such as the Million Hearts Initiative, Healthy Living, Healthy Eating, and also work with faith-based organizations in implementing the Train the Trainer, Keep on Track, hypertension prevention programs. And this has been ongoing for many, many years, even prior to the pandemic. When COVID-19 hit, we know that there's a greater need in terms of reaching out to our community. We are so blessed that through our collaboration with the Asian Pacific Islander American Health Forum, we were able to facilitate the Project First Line grant. And nationally, we have reached out to different chapters in collaboration with other AA and HPI community in the dissemination of COVID-19 prevention. We have 3 IPC champions that have been promoting the COVID-19 prevention awareness and education. At the same time, we utilize social media to reach out to the different community leaders. We in fact translated some of these materials into our dialect, like for example, Tagalog, and the second dialect is Ilocano. So we have been working hand in hand for the past years, but even prior to that, a lot of our chapters have also been engaged with the All of Us research program. We understand that we are underrepresented in terms of research in the Asian community. And the only way for us to do that is really to contribute and be part of that process. So we are glad that a lot of our chapters have volunteered, and hopefully we could continue that collaboration with other organizations. I know for sure that through the INSIMNA, which is the umbrella organization of the Minority Nurses Organization, we have created actually a paper on how to take care of COVID-19 patients during the height of the pandemic. And this was really first spearheaded by non-president. So we're glad for that collaboration as well. And as a member of ANA, as an organizational affiliate, I know that Dean Sullivan Marks have mentioned that we are working together in addressing racism in nursing. So there's a lot of work that has been facilitated. Cross collaboration with organizations is very important.
Well, for us, collaboration is key. It's almost everything, and we've really used it to drive a lot of the issues that we are facing. Because a lot of the times, especially as minority organizations, we're facing similar. All of our issues aren't exactly the same, but a lot of times they're similar, or they can be advanced through a similar pathway. So a key example of this is we've collaborated several times with the non-New York chapter, naturally because of the professional working relationship myself, Dr. Gillis, has with Dr. Michelle Crespo. And when the pandemic first hit, a lot of us that are nursing leaders who aren't bedside or aren't inpatient didn't realize at first how bad it was. And it was for us to listen to the rest of our membership about what they were going through in the bedside and inpatient. And then that led to larger issues. And what we were able to do with working with non-New York was that create a platform where, okay, I can go out and get the Black politicians because I have a relationship with them. But now non-New York also has a relationship with all of the Latinx, Hispanic politicians as well. So now instead of just having 15 politicians, we have 30, right? And then we did the same thing with nursing leadership all throughout the hospitals. Instead of having 15 nursing leaders, we have 45 now, just by collaborating. And now we have everybody together. And it just worked out. It worked out very well in terms of advocacy. It was also a great chance for us to decide exactly what we wanted. A lot of the times nurses, and I think it's because of sometimes the way we're trained, sometimes the way we are in the hierarchy order, especially within hospitals, we're told only to take orders, right? We're told to execute orders that are dictated to us. And nursing goes so much further beyond that. And collaborating can help you find your voice to go beyond that and provide insight to your community and really affect change within your community.
Dr. Garcia-Dia and Dr. Johnson did a great job sharing the collaborative work that we've done nationally and also locally at the chapter level. And I'd just like to reiterate with nationally with INSEMNA playing a role in coming together as organizations to develop educational. We had a recent policy summit, and it was really nice because once we got all of the leaders and chapter members together, kind of thinking of in the future ways for us to collaborate and work on policy and advocacy and how we can make that work, maybe meeting together and sharing, resources or a conference in DC. So that was really exciting to see that we are looking to the future of how we can expand our work together. And also our work with the ANA Commission to address racism in nursing, making sure that we have a voice and we're able to, impact practice, policy, research. And it's really exciting because a paper will be coming out, as mentioned earlier, by Dr. Garcia-Dia. So that'll be more to come in fiscal year 22.
Well, thank you so much, panelists. It really provides a wonderful perspective on the strength of collaboration. It's also great to hear that collaboration occurs among your organizations and also occurs at the national level. So it's really a strength in advancing your goals with regard to social justice and health equity. But my question, which I would like you to really share to the audience is, yes, we've identified some of the strengths. What do you see as really gaps that we need to address from your organization perspective so that we can reach the health equity and the social justice goals that we have been striving for? So anyone, well, I'll start again with Dr. Garcia Dia for your thoughts and how we could address the gaps, or if you've identified the gaps.
I think what I've learned being part of the commissioner to address racism in nursing is that conversations like this needs to continue. There has to be transparency and creating a space that it's safe to be open and talk about it. I think just like what Julius had mentioned before, the death of George Floyd really spurred, right, triggered that pent up emotions that people feel so many years. And I think this is a great opportunity for us to really look at our own self, do our own self-assessment. In fact, that's what we've been trying to do within PNAA in trying to understand what is racism for me. What does that mean to me? Obviously, there's so many cultural aspects, especially from our end, particularly for myself, coming as an immigrant here in the United States, plus, of course, the history of colonization of different countries. All of these factors influence who we are and how we view racism and how do we address these issues and then integrate those cultural values as part of that process. So I think having listening sessions, having transparency, and making each other feel safe and being an ally for that other person if they're not comfortable.
I'm going to switch it up to be fair. I'm going to let Dr. Nava go before me, and then I'll go in after her.
Okay, thank you. So some of the gaps, I've noticed is education-wise and creating more opportunities for nurses to have mentors and role models and see people doing things that they've never seen before. And especially for the Latino population, sometimes they're the first in the family to attend college or the first in the family to be in a health profession. So really building those pipelines and making sure that not only do they have access to scholarships, but they have access to mentors. And then looking at community partnerships, I think sometimes as nursing organizations, we focus heavily on, how do we collaborate with each other? But then looking outside of just healthcare, how do we advocate with organizations that are focused on housing or climate or other issues that also impact health equity, and making sure that those partnerships exist. And then also from a leadership perspective, I think a lot of times we want our nurses to take on positions of leadership, but they don't necessarily have the experiences or the tools or, again, the mentors to kind of bounce ideas off of. And I think we sometimes learn trial by error with leadership. So creating structures and programs to make sure that when we have nurses step up into chapter leadership positions or even run for national office, that they're prepared to address some of the topics or issues that come up, and especially when they advocate for underserved communities.
So for what I've seen, first I would start with understanding what you don't know, meaning we're in a time where everybody's talking about diversity, equity, inclusion, but a lot of people aren't talking about the history and that this is a whole specialty of people who teach it. And a lot of times what happens is people look for us and go, well, hey, you're blackface. Let's put you in front of a camera or in front of a computer and you can talk about DEI, right? And some people aren't comfortable with doing that and they don't know the history of it and how it's supposed to look. So making sure that we learn what we're supposed to learn. And it's interesting because before this call, I was on a call at LIU where we talk about DEI. We brought in a mentor of mine, Dr. James Pogue, and he was just talking about simple things like, his company gives out certificates for individuals to teach DEI, right? And it's something as simple as that people don't realize. But that's a huge gap that we need to fill in. Especially if we're going to be the leaders talking about it. The other things that often comes up is that respecting when some of us don't want to talk about it. Like we have different traumas, each of us, right? Myself, that I descend from a family of slaves here in America, right? Passed down generation to generation. Some of the trauma that my parents experienced, that my grandparents experienced, right, is things that they don't necessarily want to talk about, and respecting them not to force them to talk about it. And then at the point where we do go and we get the training, we become leaders, that, you know, we're in our space. Sometimes we have to be unapologetically about the issues that we're talking about, because other people can't necessarily relate to it. But if it's something that's changed, sometimes you have to make people the right kind of uncomfortable in order to get to that change.
Thank you so much. So, you know, I'm taking notes, and really our conversation really now has evolved to addressing something that we need to address, and that is the systemic and the structural inequities that have really facilitated all the health inequities and disparities that we see. So I'm going to switch gear a little bit here and really ask from our panelists how each of your organization is really making an effort to educating the public out there about the effects of this systemic and structural structures, the structures that have really made this health inequities and health disparities happen. And if you can share as to our audience, how could we have that conversation, a really, you know, honest conversation about the things that impact health and healthcare? And anyone, again, I'm going to switch the order in here because we've been on order here, but anyone in the group, in our panel, can please address that.
That's a very challenging question, Dr. Emerson Iya. I'll take a stab. I know that when I started volunteering in the community, from my experience, that's how I really realized what model minority myth is. Because when I volunteer taking blood pressure in a church, I see people that cannot afford. I see stories and hear stories about people not wanting to go to emergency departments because they fear that they might be deported. I hear stories of people trying to save money to send back home, and instead of getting their own medications. So all of these things are really contradicting the model minority myth in the Asian community. And I think this is where our effort is in trying to start looking at data and really trying to look at the disaggregation of data amongst communities so we could fully understand what's the greater need. When I tried to apply for community-based participatory research grant, another challenge that I encounter is that it's hard to justify the why do we need to get the funding, because there's not much data representing the AAPI community. So again, it's almost like a circular, as what you have mentioned, institutionalized type of barriers that we're trying to get through. And I think with all these conversations and position statements that we have done for many, many years, it's really about time for us to have real conversations with our policymakers and legislators to connect the dots and get that data based on our conversations with other Filipino American groups, particularly those that have addressed why there is a disproportionate number of Filipino nurses affected by COVID, even though we are only comprised of 160,000 all across the United States. Almost 30% of the mortality rates of nurses during COVID-19 was coming from the Filipino American community. And it was hard for us to understand, but through the help of social media, right, and also the newspapers, they were able to crowdsource and really understand the number. But that should not be the case. Data should be readily available. So I think that's where we need to still continue to address the gap, and from our organizational perspective, continue to push that envelope in order to advocate for data.
Dr. Nava, you want to go or you want me to go next?
I can go. It's fine. So I think, as Dr. Garcia Diaz mentioned, this is a very challenging question, and a lot of the work nationally has occurred within the ANA's Commission to address racism in nursing, and trying to. We had our first kind of like summit meeting a couple weeks ago, and it was really eye-opening, the psychological safety that was created in that environment for people to share their experiences freely and be able to, if they didn't experience, racism or discrimination, to be able to speak up to it and not feel a certain way. And people who have experienced it were able to, feel safe to share it there too. And I think, to get to that point within an organization, to have members, come into spaces and be able to share their stories, because they are very unique, especially, coming from a Latino perspective. I would like to get to that point, and we do have our national conference actually next week, where we will have members coming together. And I'd like to open that conversation with them, and especially my board of directors, as we strategically plan for the future and the direction that the organization is going to go in. Two of our keynote speakers are speaking on diversity and health equity, and then another one on creating workplace environments that are conducive of feeling psychologically safe. So we are definitely going in that direction, whether it's providing ourselves as members of with the education and the capacity to talk about these things together, but then also working with other organizations to develop strategies to make sure that we are addressing this as a united front within our profession. And I really didn't like that ANA, the commission, we send out a survey for nurses to start collecting the data and seeing where nurses are at with this topic.
So I would say I look at it from a national level and a local level. So nationally, all three of us as panelists and our organizations that we represent are collectively a part of the National Commission on Racism in Nursing, right? Which is huge. First time it's ever been done, and it's going to be extremely beneficial. You also have, all of us are part of NIH's All of Us research grant, right? Where we talk about getting more people of color and disadvantaged populations involved in research, but first explaining to them and making sure people understand why they don't want to be involved in research. Nationally, we also have our Advocacy Day that Dr. Nava talked about, that for the first time in 2020, we did collaboratively with NAN on Capitol Hill, advocating for different issues that affect our communities. Locally, we run an opioid overdose prevention program, because when we started looking at some of the numbers and who were dying from overdoses, we realized that it was happening in a lot of our neighborhoods. So we needed to have a program that was going to go to these different neighborhoods. Black women in America and in New York are 4 times more likely to die during childbirth, right? So we started a Black Maternal Health Committee to start advocating for these women, to bring these families together that have these issues, and also host panels on just training virtual simulations of how we can improve these. What are things that providers, nurses, and family members can do to protect themselves? We have running the vaccine clinics, and one of the things that one of my mentors is on the panel, now on the panel, she's in attendance now, Dr. Matavo, who, when I told her about the clinic, she said, don't downplay what y'all did. Y'all didn't just give 30,000 vaccinations. Y'all potentially saved 30,000 people's lives, right? Majority of people who were from disadvantaged, lower income neighborhoods. Speaking on social justice reforms that we've done, vaccine hesitancy talks, and sometimes it gets extremely tiring, right? But a lot of the times when you in search of the leader that you want to come talk, a lot of the times the leader is right there in the mirror staring back at you. So when it comes time for you to speak up, you have to speak up and address those issues.
No, thank you so much. It's kudos to all of you nursing leaders. It's very apparent and very clear that each of your organization is doing a great deal to really advancing social justice and health equity, and to really confront the ugly truths and the ugly realities that we are facing, because we know that is a barrier to advancing health equity, and we need to talk about it. We need to really confront and name it, because it's so important to us to do that. Our conversation would be incomplete if we don't talk about the future of nursing. It's a very seminal, it's a very important document that was recently released. So since we are at Myers and we have a lot of alumni, in the audience as well as who will be listening to the podcast or to the recording of this, we would like to find out from you, how are your organization, or each of your organization is really supporting and mentoring future nurses or future clinicians, future practitioners, future policymakers, future researchers. So how is your organization really addressing the Future of Nursing report? So if you can share some of your insights, that would be great. I'll start, maybe we'll reverse the order if it's okay. I'll start with Dr. Nava.
Great, thank you. So the future of nursing is really exciting because it includes all of our great ideas to advance us forward. So when we look at the future, we really want to get more nurses graduating at the BSN level, master's level, PhD level. So we have an exciting new partnership with Abbott. They recently released a press release that they're giving $5 million over 5 years to create 300 scholarships to historically Black colleges and universities and minority organizations. So one of them being NAN. So really excited since we will be sharing that scholarship with our members to either get PhDs, masters, and BSNs. From a scholarship perspective, we recently expanded to create a new research committee, which is really exciting since we know a lot of members who are interested in going into a DNP or PhD program sometimes don't necessarily have the mentors or need to bounce off ideas or kind of get advice. So one of the aspects of the research committee would be there to provide some sort of academic support outside of the school setting. And then with leadership, we really want to focus on our chapter leaders and how do we provide continuous leadership development throughout the year. So we've started to, this year, we've kind of piloted where they would get every other month for a year, which comes out to 6 months of leadership development training. And we're looking to get CEUs or either a certificate through a partnership with the university for them to get a certificate showing their leadership competency. So that's something that we're looking forward to in the new year.
I'll focus on sponsorship, which is a way that we are really pushing for the future of nursing. And what we mean by sponsorship is putting your members in positions or creating opportunities for those members to capitalize and get leadership experience. A great example of that is just what our national president, Dr. Dawson, did with myself. She's one of the commissioners for the National Commission on Racism in Nursing. She brought me in to be part of the subcommittee group of education, right? We also talk about doing that within our organizations. We know that the first thing that nurses go through, a lot of times, like there's a saying that nurses eat their young, right? Old saying. And a lot of times we think that that's bedside nurses that eat their young. But where you really learn that from is within the school that you go to before you graduate, right? And a relationship between professor and student. So if we want to change that, I have to create sponsorship for other people within the organization to come in to where I teach at, so that they can teach and we can start creating future leaders and get rid of that stereotype that nurses eat their young and change the culture of nursing just from education wise. When it comes to partnership, right? And the report talking about nurses being in a great position and having the ability to partner these complex organizations. An example of that was when we partnered with a community health clinic, and then we partnered with Stop the Spread and partnered with Black churches in the community to run the vaccine clinics, but also talk about vaccine hesitancy, because we understood that it's easier for people to get care by people that look like them, right? They're just more comfortable when they go in. If I walk into a Latino, Latinx neighborhood, right, I'm gonna want to bring a provider that's also Latin and speaks Spanish, because I know it's just a comfortability for somebody to talk in a language that they understand, right? And I know that I'm not supposed to take offense to that. So creating those type of opportunities for people and for our organization to develop future leaders.
So PNAA is doing similar programs that Dr. Nava and Dr. Johnson have mentioned. One thing though that we are focusing primarily is the psychosocial and emotional impact of COVID-19 to many of our members in the community. So I know that the Future of Nursing campaign have actually cited organizational resilience. How do we fuel that passion for us to continue to keep moving? How do we build up that resilience within our organization so we can address the challenges that we all experienced during the pandemic, especially with the supply chain? How do we influence policy and legislations on that? I know that this is also a nurse practitioner week, so happy Nurse Practitioners Week to everyone in advancing the full potential of our advanced practice nurses. So I am proud that PNAA has a very strong practice committee that mentors each other, and we actually expanded and created a subcommittee to recognize our nursing informatics specialty group. Of course, I'm wearing my hat as a nursing informatics. I wanted to, of course, promote that because this is where we're going to be in terms of promoting telehealth and really advancing technology and merging the utilization of advanced practice nurses so we could deliver primary care not only in urban core communities, but also in rural areas. So I think a lot of collaboration needs to happen with that as well. Continuous sponsorship and mentorship to our young leaders and facilitating senior leadership in the organization so they could be future leaders in our nursing profession.
Thank you all panelists. I'd just like to make mention that being involved and being engaged with professional, especially minority nursing organizations, is mentioned at the report as one way to really getting to know the work of these minority nursing organizations. So thank you, panelists, for really providing very specific information as to how you're advancing the future of nursing report goals. I know many in the audience right now are wondering, yes, these are all great information, but I really want to also participate and be a part of these organizations to really contribute to achieving their goals. So again, panelists, if you can chime in and provide our audience some ideas, how can they get involved in your organizations in achieving your goals to achieving health equity and social justice? I'll start with Julius, Dr. Johnson, for a change.
I'm sorry, repeat that question one more time.
Yes, so I was asking how can the audience, I know many of them are wondering, how can they get involved in all these wonderful initiatives and efforts that you have described? So if you can provide some tips to them on how can they do that?
Absolutely. So I would say first, just sign up to be part of the organization. There's even some organizations that let you be a part of them before you actually join, meaning come out to meetings, come out to events. And really, I believe in creating safe places for you to practice, meaning practice your leadership, practice your collaboration, because we need places where we can safely practice, because it is okay to fail, right? And coming out to meetings and coming to events is the perfect way to do that. And then also, I think getting involved really also means find something that you're passionate about, something that means something to you. And if you don't have it within your organization, I'm pretty sure your organization wouldn't be opposed to creating it, right? Perfect example of that is our Black Maternal Child Health Committee. Now, because I'm a man, I was completely ignorant to what Black women were going through with childbirth until it happened to my family, right? Until it happened to my fraternity brothers. And then I said, oh, this is an issue. We need to do something about it. And when I brought it up at the chapter meeting, it just so happened that we had a bunch of OBGYN and pediatric nurses that said, oh, we've been waiting to do something about that. Okay, cool, let's start a committee about it. Let's actually do work, let's do things. So we've been very big on, if we don't have a committee that tells us to something you love and want to get involved with, create it. and then we will give you funding and we will help promote it to members so you can create your own subcommittee. We don't want you to feel like you need to go outside of the chapter to do anything that's important to you.
Thank you, Dr. Johnson. Any Dr. Dia or Dr. Nava, please feel free to chime in.
Sure. So I would encourage you to volunteer, see what we're doing. Sometimes the perspective is different when you are inside the glass, right? So try to join one of our activities. We are actually planning for our International Nursing Conference in January of 2022. Unfortunately, we can't go home to the Philippines, but if there was no COVID, we would normally go home every 2 years. And it's a perfect opportunity for us to connect back to our roots. And at the same time, provide community work. We do medical missions back home. Some of our chapters facilitate that. We also work with the Association of the Philippine Colleges of Nursing in providing teach back. We call it balik turo. So anyone who is interested as a subject matter expert in specific subject that they would like to share, our School of Nursing back home are super excited in welcoming you. So volunteer, reach out to us and be a member.
And I'll just add on, if you're interested in joining NAN, we do have our national conference next week, but we don't have any more in-person tickets, but we do have online options. That's a good way to kind of get familiar with the kind of speakers and contact that we have available to our members. And also locally, there's a chapter near you, more likely than not. So our website is nonnet.org, and you can follow us on social media to kind of see what we're looking out to. If there's something in specific that you're interested in, you can feel free to reach out to me via email. My email is nava.adriana@gmail.com, or you can find me on LinkedIn, and I respond pretty quickly. So looking forward to working with all of you.
Thank you so much, leaders. So we got something out from this conversation from the individual and the group, and how to get engaged, how to be involved in really advancing the same goals, health equity and social justice. I'm looking at that time. That's really the time that we have for our panel discussion. I wish we have more time since this is a very interesting discussion, but I'm quite sure our audience has many questions or several questions to the members of the panel, but I'd like to again thank you all panelists for such an engaging discussion. I'm going to turn this over to Dr. Brown, who will be facilitating our Q&A. Thank you again.
Thank you so much. What a discussion. So much food for thought. Let me go over to the Q&A. And I noticed when I was looking in, there some questions came in to the chat. Remember, it's not too late to enter your questions. So I'm still looking for questions. Our first question is, what changes in the curricula of nursing education and hospital orientation of clinical nurses have been made to address racial disparities in health and in increasing social division that we experience today? Any of the panelists can answer this question. What changes are you seeing in nursing education and hospital orientation to address these racial disparities?
I know that from the healthcare organization perspective, there has been a push in trying to promote the social determinants of health, just trying to understand what that means. It's actually part of the assessment, and we are actually monitoring how do clinicians answer this. So this way we could provide more education. So far from a conversation perspective, I know that's part of the onboarding process in terms of providing classes on diversity, equity, and inclusion. So we can have a better conversation with regards to racial justice and also addressing our patients' needs in understanding their cultural values. So a lot of these things are already in place in our organization.
Thank you so much, Dr. Mary Joy. Anybody else want to chime in on this question?
Yeah, I'll jump in. So first I want to say that it's a very that's almost a very individualistic answer in terms of the institution that you're at. I will say for some of the nursing education, as far as curriculum goes, one of the things that we did within our grad program was we started mapping out racism within the grad program, meaning all of the courses, what are some of the areas that racism comes up in, right? Case example is that some people put race as the social determinant of health. It's not race, it's racism, right? So mapping those things out, mapping out when we would talk about blood pressure in a way that some Black people would be prescribed medications compared to others. Mapping out things like for diabetes care, some people, depending on their insurance, would get access to GLP-1 receptor agonists, while others would get put on other cheaper options of medications, and then we'll look at the disease process. So that was one of the keys that we did in talking about it. Further than that is there's a lot of work that still needs to be done in terms of social justice and curriculum within higher education.
And from a quality standpoint, if we look at the healthcare system, we know that our data is not that great when looking and trying to track health disparities. And even when we look at different states, you can see that some states report and some states don't report. So from a policy perspective, it'd be great to have a national push where we can get better data. And then when we start looking at performance of health systems, what standard or benchmarks are we holding them to so we can make people accountable throughout the whole healthcare system.
Thank you so much for those responses. I hope the attendee who asked that question got something that they were expecting, or maybe some surprises of what is happening. So we heard several persons on the panel mention about the role that they're doing in the community, especially in the fight against this COVID pandemic and the different initiative, COVID vaccine administration, and the different information about it. One question that came in: what role does the professional nursing organization play in combating misinformation or disinformation regarding COVID vaccine targeting our community? Open to any panelists.
So I'll jump in and answer that. One of the biggest roles that we play is talking with our people and not talking at our people. And like I often tell people, yes, I can tell you that I ran a vaccine clinic. I can tell you that I've given over 50 talks on vaccine hesitancies. But I can also tell you that when I go home and I hang out with certain family members, there's certain of them that are just never going to get the vaccine, right? And I continue having a conversation with them, but I also understand what their experience with healthcare is. Like the experience that you get in healthcare when you come from certain neighborhoods. So I was born and raised in Brownsville, Brooklyn, New York, which is one of the highest crime, lowest income, high poverty areas in the entire city. And everybody from that neighborhood on top of two other large neighborhoods are all pushed into one hospital for the most part, which is Brookdale Hospital. So you get a very overcrowded experience of healthcare at that hospital compared to if you go into Manhattan and you have NYU on 34th Street, you go up the block into the 50s and you have NYP Cornell, then you have the Hospital of Joint Diseases, right? Like you get a very different experience of healthcare when you go to those institutions. So I have to understand what somebody's experience with healthcare has been in order to get them to change their mind about research and COVID vaccine and everything. So we're not going to do that. We're never going to be able to reach them. So really being patient, really being understanding and talking with them and not talking at them.
One thing that we have also facilitated from our end is reaching out to trusted leaders in terms of speaking about their own experience. We have a lot of our nurses who had experienced COVID themselves, and we also have nurses who were hesitant in getting the vaccine. But ultimately, some of them did end up getting the vaccine because of the experience that they had, and they were willing to share their stories. I think that's the powerful part of it, sharing your narrative, sharing your stories, and at the same time inviting subject matter experts within our own Filipino community that really helped a lot of conversations, driving those conversations so people can be more open to talk about why is it that they don't want to take the vaccine. Some are really driven because of religious reasons. And that's one thing that we have actually discussed during our first conversation that was facilitated by ANA, recommending them to also include not just the scientific part of it, but also having religious leaders and at the same time pharmaceutical companies be part of that conversation.
And then also, we focus on the educational aspect and using nurses to speak to communities and even other nurses through partnerships with ANA to dismantle the facts. And I recently read that I believe Facebook posts for misinformation in Spanish, 70% of them weren't flagged or corrected compared to 29% in English. So our Latino community got a lot of misinformation when it was in Spanish. So being available to speak to our community in Spanish was really important.
Thank you so much for sharing those insights. So much of the discussion that we had is about what the organization is doing for the community, right, outside of the organization. There's a question in the chat. I don't know if it's restricted to the PNAA, but this person was a member of your group, Mary Joy Jill. And the question here is, what have been done within these organizations to be more inclusive as they recruit millennials, Gen Zs, to get them engaged in these social justice causes?
Yeah, that's a great question from Eileen, and I appreciate that. I know that there is what we call as intergenerational gap. And I apologize that we lost you 2 years, when is that, 15 years ago, and I hope that you will come back to the fold. We, within our leadership development program, we in fact have facilitated topics on engaging with the millennials, having the subject matter experts in driving conversations on what type of leader are you? Are you a guardian? What is your voice? So this way people could see the multi-generational gaps and how communication is facilitated from a traditional point of view versus a younger generation. So we made those type of educational programs to address those type of issues. But at the same time, we also partnered with other organizations to encourage interest from millennials like you who might be interested in climate justice. In fact, we started our collaboration with the Association of Nurses for Healthy Environment. And I know that this is close to everyone's heart. So hopefully those type of programs could offer a variety of choices for people to select from a volunteer perspective.
I'll also answer that because I think that's an issue that all of our organizations have, even the younger chapters. And for us, we deal with it with losing members, but then gaining a whole bunch of new members the following year. And I think sometimes it comes down to, we really just have to listen to what it is that they want, right? Depending on the millennial that you're from, sometimes the way you go about change can be very different. But being able to listen and understand and find a intersectionality of where we can all meet and do work, and also understanding that we can do work differently as well without going against each other. Key example of that was when we held the protest, we call it Healthcare Workers for Black Lives. A lot of the older generation wasn't necessarily comfortable with protesting, but the millennials and Gen Zs, I need to go out and scream and shout and yell, right? They needed to do something about it. And for me, kind of being at the middle between the two, because, you know, I come from parents that did it. And then also as an undergrad in Binghamton, I had to do it. So I was just waiting and really honestly just wanted an excuse to go out there and protest. And as soon as they said it, I was like, okay, cool, let's do it. But it was a way that they felt heard. And then moving on from that, we also had to then decide we need to open up our leadership, right? Like we can't think that we created something and we're the only ones that can cultivate it. We have to believe that what we built was built in the right way and with a foundation that it will survive after us. So we have to give them, the younger generation, leadership opportunities to lead, right? Safely. And if they make a mistake and if they fall off, be there to catch them and put them back up and talk to them about it.
I think NAN has done a good job embracing different generations. Throughout, the elections we see in the board, we get a good number of millennials being elected. I was elected president, so that was exciting for me. And I hope to, live up to the leadership of previous presidents, but also our Latino population in general tends to be younger. The average age for Latinos is 30. So even as we recruit new members, a lot of them are going to be of a younger generation, and we want to make sure that we have the types of programs and educational opportunities available for them as they come in, but also that we can use our core members and those with a lot of experience to be those mentors to so that they have the support they need to be successful.
Thank you so much for those great contributions. And this is showing that we're all learning, but we have to start somewhere. As you heard the panelists discuss, we're at different places in the trajectory. Some already got the secret sauce and is doing well, and some are forming and norming and getting there. But one thing I'll take away tonight from this, and I hope you can agree with me or at least associate with me with this, is this is just 3 organizations. Think about the other organizations that may be right in your community, maybe in your church, maybe in every nurse should be a member of ANA. That's our National American Nursing Association. So if you're a nurse and you're not a member, you need to become a member, because that's how our voices will share what our needs are. You heard Dr. Johnson share many of those initiatives in our community that we can relate to, even stuff that he as a man would not, you would think, oh, he wouldn't have any interest in maternal health, but he's fighting for that cause on our behalf. So get involved. Some of the things that I'll take away tonight is get involved in research. Either you are the one driving the research or being a research participant. Get involved in advocacy. Use your voice. Get involved in volunteering in your community. This is our call to action. It all starts with a conversation. It all starts with you. What are you doing? What can you do to further this conversation about social justice and health equity? We all have a role to play. A few terms or catchwords or buzzwords that came up as we were talking tonight, I just want to bring it to your attention, some of them. The right type of uncomfortable. What is that? The conversations may not be easy, but they're worth having. So as we talk about diversity and equity and inclusion, it's going to be uncomfortable conversations, but it's okay. Get involved, get educated. The resounding theme around the future of nursing, as each of the panelists talk about, is get educated. With education, we can open doors and windows. So I want to thank you all for joining tonight. Thank you to our panelists for this incredible, thought-provoking discussion. I wish I didn't have to end here, but our time is far spent. We appreciate your time and support of the NYU Myers community. Our guests, thank you all for attending tonight. We hope that you have some great takeaways for advancing social justice and health equity in our communities and workplaces. Remember, whether it's in the classroom or in the boardroom, or at the bedside or the chair side or the community, you have a role to play in advancing health equity. So if you enjoyed this evening's panel, I encourage you to attend future alumni events like this. And one is coming up on Thursday, December 2nd, and that is the Nursing Administration Alumni Council. They'll be having their annual CNO panel. You can't afford to miss that. More information about this panel can be found on the Myers website. What better time of this year to say, we appreciate you, thank you. In a couple of weeks, we'll be celebrating Thanksgiving. And, given this pandemic, this year is going to be much better that we can see our families. And Veterans Day is just around the corner. So as we look at the advances that we have made and look back on the work that still is left to be accomplished, let us remember that we all have a role to play. So stay safe and have a healthy one. Thank you for joining.